And we are live. Hello, everyone. In healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language that you can understand. We create a safe space for you to ask your questions and share our nursing perspective without taking too much of your time. Today, we'll be speaking with our special guest, Kelsey Wilson. Um, we've had Kelsey on in the past for quite a few episodes, so welcome back.
Thank you.
Kelsey is a special guest here for us at the Melanin Initiative podcast. She has been a guest on our show previously to discuss intergenerational trauma, navigating the holidays with family, anxiety, depression, and suicidal ideation, emotional healing, and eye movement desensitization reprocessing. We are excited to have her back with us again today so that we can discuss trauma. So today's episode will be based on trauma. If you're new here, welcome to the Melanin Initiative. I'm Geraldine, and I co-host the show with along with Alicia and Kimberly, who sends her love in her absence. We are a health literacy podcast offering our nursing perspective. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and to use that information to manage your health and advocate for others. It's our hope that by watching on YouTube, LinkedIn, Instagram, Facebook, or listening on your favorite podcast app, we hope you feel empowered to ask those questions, educated on how to manage your health, and confident to navigate the healthcare system. If you haven't already, leave a comment or two as this helps us help you. If you haven't already, also subscribe so that you can be notified when we release a new episode. Thumbs up the video and leave a comment or two. Once again, this also helps shows the algorithm that this information is important, so that when people go out and look for the information like this, it shows up higher up in their search results. As a reminder, this show is for educational purposes only. The opinions expressed here are our opinions alone, and they are not a representation of any of our affiliations. If you are experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you can call 911. And if you're having a mental health emergency, you can call 988 or text 741 741.
So, welcome back, Kelsey. We are so excited to have you here with us today on the Melanin Initiative.
Yes.
So, let's start with you reminding our audience what it is that you do and what services you provide.
Definitely. Well, thank you so much, ladies, for having me back on. I'm so excited to be here. For those of you who are watching for the first time, my name is Kelsey Wilson. I'm a licensed clinical social worker. I'm a therapist for women who have experienced childhood trauma or going through anxiety or depression or burnout, life transition issues. My practice is in Virginia, recently licensed in DC. So for those of you who are looking for a therapist who's licensed in DC, reach out. But yes, I have been doing my practice for a while now and went full time. I know we talked about that the last time I was on the podcast. So things have been going really well, and excited to be here to talk about trauma and give some education to the audience.
Well,
Awesome.
we're glad to have you back once again, and it's great that you are expanding your licensure across different states, or different areas. So that's amazing.
Yes.
So let's just dive right into this episode. So let's start off by defining what is trauma.
Definitely. So trauma looks different for each person. And I want to start off by saying it is really a person experience situation. But just for definition purposes, trauma is physiological, it's emotional. Sometimes it's a physical response to an event or a series of events that are overwhelmingly distressing or harmful. So it happens when a person experiences something that's really intense or threatening and it exceeds their ability to cope. And that kind of leaves them feeling helpless or scared or violated. And so trauma can have a lasting impact on a person's mental and physical health, relationships, their daily functioning, but it can also impact families as well. And I know we've done an episode on intergenerational trauma. And so please check that episode out if you haven't already. But I work with a lot of women who have experienced intergenerational trauma in their families. And so either their mom or their grandmother had trauma that was unresolved. And then as a result of that, it kind of trickles down onto the future generations. And so Sometimes women are the first in their families to come to therapy. They come see me, and we talk about those things. So that's just a snapshot of what trauma entails.
Wonderful. So you just mentioned about, family and intergenerational trauma and how that could be the source of an origin for trauma. But let's dive in a little bit deeper about what are some of the origins of trauma and like where does this come from?
Definitely. So, trauma, it can happen to an individual, it can happen to families, it can happen to groups of people, generations of people. It can be systemic as well. And I think a lot of people, when we think about trauma, we kind of put it into this box, but it's
Mhm.
really large. And there's different types of trauma too. So there's sexual, there's physical, emotional, there's also financial trauma.
Mhm.
And so for those of you who don't know, like financial trauma could look like someone withholding access to funds from a loved one, or we have situations where a caregiver is taking care of someone, and they're like overseeing their funds, and they're not necessarily allocating the funds correctly the way that they should, or abusing abuse of power in that way. It also happens in marriages too, where someone is the primary breadwinner maybe, and they're not allowing their spouse to access means to funds as a means to kind of control. So there's a lot of different, scenarios of financial abuse, and there's intergenerational trauma as well, which we kind of touched on a little bit too. So there's a lot of different types.
Interesting, interesting. And how does trauma typically show up?
Yeah, so trauma can affect you in various ways. The physical symptoms, it could look like sweating or startle response, or, your hands shaking, or could look like your heart racing. It could also show up as nightmares, or having panic attacks, or being hypervigilant, where you're kind of on guard. I'm not sure if a trigger is going to pop up, or maybe a trigger has popped up, and you're not sure if you're feeling safe in that scenario. So your flight or freeze response kind of kicks in.
Mhm.
It can also show up as not trusting others, or being hyper independent. And when I say hyper independent, I mean like I can do everything on my own because I always had to do everything on my
Mhm.
own.
Mhm.
Could also look like anger or difficulty connecting with other people, whether that be in interpersonal relationships, or at work, or in environments where maybe you want to have closeness with people, but it's just really hard because of your past trauma.
Mhm.
Those are just a few examples.
So it's interesting because it doesn't so from like a social work perspective and in your practice, you wouldn't necessarily diagnose someone with trauma, but it seems like trauma is more of a subjective experience that someone has. And it kind of reminds me of in our nursing practice, patients that have like pain, for instance, right? Pain is what the patient says it is, right? So like we try to put objective measures on it to try to make it make sense for us. But
Mhm.
bottom line, if that person says they're in pain, we have to believe them, right? So is that a similar sentiment in trauma, right? It's like, if the client is saying that what they're experiencing is trauma, you kind of have to go with that and explore what we can do to kind of help support them.
Yeah, you bring up a good point, because I think that sometimes, like when we're talking about trauma, there's different types of trauma. So some people might experience trauma in terms of like traumatic invalidation. Maybe they grew up in homes and households where they didn't feel like they were listened to, or they
Mhm.
felt like their experiences were invalidated and they just didn't feel cared for. All the way to more physical types of trauma, where it could lead to PTSD symptoms, post traumatic stress disorder,
Yes.
where you felt like your life was in danger, or you experienced a sexual assault, or you witnessed someone else's life being threatened, or you maybe experienced, someone losing their life. You saw that, or you felt like your life was in danger in that way. And so that manifests as, you having the clinical diagnosis of post traumatic stress disorder versus just experiencing a trauma that didn't lead to the severity of having post traumatic stress disorder. So I do diagnose clients with PTSD in my practice, but some of my clients, not all of my clients have PTSD. Some of them have traumatic experiences that were really significant, but they don't meet the threshold for post traumatic stress disorder.
Understood. So perhaps the trauma can lead to a diagnosis. Your trauma could lead to a depression. It can lead to anxiety. It can lead to post-traumatic stress disorder. I understand. All right. So, in your professional opinion, how do you think trauma impacts communities of color versus maybe other communities?
Yeah, so that's a really good question. I think earlier we were talking about like systemic trauma. And I think sometimes, communities of color have gone through, discrimination within their community, lack of access to resources, or, experiencing like discrimination in the workplace, and different experiences that, are unique to communities of color. Um, that's just like a few things. Like we could go into more and more things, but it can lead to a lot of different things for communities of color, such as like depression, anxiety, chronic stress. And then I know you all are nurses, so the health issues that kind of come from dealing with some mental health concerns, and it can lead to, health concerns that get not necessarily treated or kind of get made bigger because of the fact that there is kind of other systemic things that might be coming into play, such as like lack of access to healthcare and like insurance and things like that. So the list kind of goes on and on. But yeah, trauma and communities of color. We could have a whole episode on that.
Right. Like as you're
We
talking,
could.
it's like there it is. Ding,
Yeah.
ding, ding. Next
Yeah.
topic.
Yeah.
Absolutely.
Yeah.
Yeah, it's interesting you brought that up because obviously in our practice as nurses and as a nurse practitioner, when I'm seeing patients and they're there for their medical reasons, whatever brings them in, you can't ignore like the stuff. Like sometimes they'll kind of mention certain things, and you can't ignore those things because those traumatic experiences that they are having definitely are impacting their health and their well-being as far as like physical. So it's very valid that you brought that up, and it goes hand in hand. What are some actionable steps for the audience though as it relates to trauma? Like what can they do?
Definitely. So I would say for the audience who's watching today, if you or someone you know is experiencing the side effects of trauma, definitely seek help. I would say working with a therapist who's trauma informed, who can help you work through what you're going through can really make a difference. So, some people choose to do hourly therapy in a one-on-one setting, or they choose to do group therapy if that makes them feel more comfortable, or therapy intensives, which are extended sessions where you really work on a targeted specific issue for a couple of hours over the course of a few days. And those are available to people who, have gone through therapy before, or if you're trying therapy for the first time and you're like, I really need to dig into this issue that I've been having that's stemming from my trauma. Um, so there's a lot of different ways to access treatment, but sometimes it can feel overwhelming when you're first getting started and you're not sure where to start. So I would say booking a consultation just with a trauma therapist to kind of see what trauma treatment entails can be a good first start. And then sometimes they can give you some suggestions on whether that's the right fit or who you should go to treat your specific issue.
Absolutely. I know we've talked about this before, but definitely finding the right fit is absolutely important when it comes to all different kinds of therapies. Because as you said, maybe someone who's not trauma informed may not be the best fit if that's exactly the kind of treatment that you need. So you bring up an excellent point there. I believe in our previous conversations that you don't specifically work with children. However, have you ever had to counsel a parent that was having some challenges with teenagers or trying to help them navigate through some of that?
Yeah, definitely. So I work with a lot of moms in my practice. Some of them have teenagers of their own, and they'll come to session and we'll talk through how to navigate some of these challenges that come with a teenager having their own trauma, or as a parent, you kind of working through your healing process of maybe having not the best experience with your parent or your caregiver, and now you're trying to put your best foot forward and be present for your teen. But it's hard because it's like sometimes even when we don't want to, we kind of mimic or model the things that we saw our caregivers do when it comes to communication with our kids, or navigating like difficult situations with the school, or trying to operate like having a healthy relationship with your partner and parenting your teen at the same time. A lot of triggers can come up for parents if they've gone through their own trauma. And so, really being in therapy during that time to work through some of those things can be really helpful. Um, because that unresolved trauma, it kind of goes back to that intergenerational trauma piece that we were talking about earlier. We really want to be working on our healing so that we don't see some of those side effects of the trauma kind of trickle down to the future generations. So, I'll work with my clients who are moms on how to co-regulate, how to teach their kids how to co-regulate emotion. Sometimes teens are going through a lot of changes, hormone changes, friend issues that are going on at school. And so that can create a lot of emotion. But as parents, we step in and teach our kids how to do conflict resolution, how to manage stress and anxiety and, the demands of school, or if they're in sports and things like that. So we'll have conversations in session about how do we role play, how to have this conversation with my kid when they're going through all of these up and down emotions, or having like a hard time in school because maybe as a parent, you never got that help. And so it's hard to find the words to say to your kid when they're going through a stressful situation. So that's what really therapy can help with in terms of, working with someone who has kids and they never really got that level of support growing up.
We talk a lot on the Melanin Initiative about vulnerable populations and such, but you mentioned speaking with moms, but do you ever have an opportunity to speak with fathers in these specific spaces as well?
So I work with women. My practice is for women, but I will talk with the clients that I have about how to help their husbands or how to help their partners have some of these difficult conversations as well. So that's my way of kind of giving back to the dads in that respect.
Wonderful.
Nice. Well, how can the audience stay connected with you?
Definitely. So I would say if you are on Instagram, definitely follow me. Kelsey Wilson PLLC is my handle. Please do check out my website, kelseywplc.com, if you're interested in booking a consultation for one-on-one therapy, or if you're interested in therapy intensives, which are extended sessions. In January, I will be rolling out a women's empowerment workshop that's going to be 4 weeks virtually. And so it'll be an hour, and we'll be talking about different topics such as self-care, burnout, planning for the future, goal setting for 2025. So if that is an area of interest to you, definitely do check out my website with that information on how to get enrolled. But yeah, I would love for you all to stay connected. So please do feel free to reach out to me. And I also give referrals too for people who are looking for therapists for their families as well. So definitely stay connected.
Awesome. I was also going to ask you one more question about, and we will, first of all, let me back up. We will definitely make sure that the information for Kelsey's event is going to be in the description box so that anyone who is interested in attending and supporting can absolutely do so. But I want to circle back really quickly regarding more of our vulnerable populations and what support can be provided to our LGBTQIA plus community as far as trauma services.
Yeah, so I do service that population in my practice. And so if you're looking for individual therapy, definitely please reach out to me. But for those who are looking for support groups and things like that, definitely check out Psychology Today for more options on how to get connected to groups. There's a lot on social media as well of private practices that are offering groups for the LGBTQIA plus community as well. And we'll also leave some other directories in the comment section for those who are looking for like individual services or who are looking for groups.
Awesome. Thank you so much, Kelsey. It's always a pleasure to have you come and share with us here on the Melanin Initiative. So audience, you can email us your questions or show ideas at tmi.melanin@gmail.com. If you haven't already, subscribe to our YouTube channel and follow us on every social media platform. Say hello in the comments when you get there. Please share the show with your friends and rate the Apple Podcasts and Spotify and leave a comment. It really helps the show get more support and gets the message out there to those who need it. You can find all of our social media links and a list of resources related to our conversation today in the description box. We release a new episode weekly on TMI Sundays at noon on YouTube and all of your favorite podcast apps. Follow, like, and share our content with all of your friends. Thank you for watching.
Bye.
Thank you.